Hi, Dr. Dave Webster on my Media Issues page. These are just some examples of the kind of, just to reinforce what we already, I think most of us understand, and that is that the news media really is just about propaganda. It's got nothing to do, the only time that news corresponds to what actually is happening, and the real news and stories behind the news is when that happens to correspond with what the agenda of whatever the editorial and ownership of the staff is. Suffice it to say that I have contacted media from every level in this country, from my local media in Sudbury here to where I've given talks in Kingston and Ottawa, but right up, to the Globe and Mail, to the National Post, to the Toronto Star, to the Maclean's magazine repeatedly, to the Fifth Estate, to CBC, to MTV, whatever. And although, again, they've covered it very superficially, without exception, they've refused to touch the real story, the controversial things, because that would mean, for crying out loud, that they'd actually have to challenge the government and put them on the spot and actually try and keep them honest. But when has the media ever been about that? So some examples. Early on I dealt with the National Post, gave them a really interesting story. The reporter I met was really, wouldn't smile, smiled at me to say hi and then bye, but really grumpy, not very friendly at all. And when I tried to, get them to be interested, this woman interested in patients and issues, how those affecting patients. David, I don't want to hear about that. Please, nothing about patients. That's not interesting. Anyway, what I did get the story for them was the inside story with Princess Margaret Hospital. A philanthropist had donated a PET scanner to that hospital, and over the previous year, I think they'd done maybe 18 patients. I mean, an absolute travesty and abominable situation, but exactly, of course, what they wanted in Ontario. But again, this reporter would not touch a single issue behind the stories that would have been so critical, that would have been, maybe this website would have been not necessary. The Globe and Mail I dealt with in lots of levels. I dealt early on with one of the reporters, a very nice woman, but I knew within 5 minutes that as much as that reporter might think, this could be a real groundbreaking story for a young reporter trying to get ahead, but knew within 5 minutes that the editors wouldn't let them touch that story ever. And a little story did come out about that, and a series of things about cancer in Ontario, but not a single issue was covered. More recently, I spoke with one of the Globe and Mail, or I tried to, but no interest, of course, was a story about that patient with Herceptin, and couldn't get coverage for that breast cancer patient in Ontario. I don't know the details of that woman's case and specifics about the therapy, but the point I tried to raise with this intrepid reporter was that you might have to ask yourself, why is it that 3 or 4, I think, were 4 other provinces who actually would have covered the Herceptin? So why was Ontario's approach different? And what I was getting at, and talked to them, left a voicemail about, and an email, I believe, was about the fact that this is what the government does with evidence-based medicine. It is a tool to which they can dial in the answer they want. Their experts can dial in the answer they want. If they don't want to pay for Herceptin, they can tweak the data so they shouldn't be paying for Herceptin. I mean, this is exactly how PET was handled. But you would have thought that would have been interesting to a journalist, but no, this is a journalist who's not working independently, but is working for the Globe and Mail and big mass media. And the last thing you're allowed to do, of course, is get the real story out, isn't it? At one interesting point, I worked with, or I got on the phone one of the senior editors of the Globe and Mail with that very interesting story. You would have thought that Dr. Al Dreger had written to Smitherman. I've got letters on the website about making serious accusations about government members of the PET steering committee were deliberately denying evidence favoring PET and so on. But more importantly was that Mr. Smitherman, who was by law required to respond to that letter, refused to, and so on. And I said to this guy, I said, you know what, Al is willing to come and talk to the Globe and Mail about this story and about behind it. I said, but you won't touch that, will you? And you know what the response of the senior editor of the Globe and Mail was to me? He said, Dave, you're too left-wing thinking. Right. This is world-class news media, isn't it? At least the way the media works in the world, isn't it? I also, approached several prominent female journalists and personalities, with details and stories and so on. Not even the courtesy of a single response from one of them. The CBC was interesting. I had obviously a young journalist on the phone one day. I sounded young, and certainly by the way they were approaching the story, it was clear that they had probably just graduated, and nobody bothered to tell them that the journalists don't actually cover the news. What you're there to do is create a story that is the illusion they're trying to get out about whatever. It may correspond to the details, but in this case it won't. Anyway, so they were very excited and distraught, quite engrossed in what I was telling them about what was exactly happening to cancer patients in Ontario and so on. I was up at 2 o'clock in the morning, gathering all the data for this reporter and putting it all together in something that she could understand at her level and so on, and get it out and whatever. But the bottom line was, as soon as she picked up the phone the next morning, I knew she talked to her editors, and there's not a chance they were going to let her touch it. But one of the most interesting ones from the CBC, I think that has shocked people the most, was that I was dealing with a very prominent television personality, usually with their producer, but I did get this person on the phone one day, and they said, well, you know, I've written about those breast pet trials, David. I don't think they're unethical. And I said, well, let me explain in detail. So I went and explained in detail, and I went on and said, you know, first and foremost, of course, it was the PET scanner couldn't actually physically detect the cancer. I mean, it doesn't get more unethical than that, maybe as far as the purpose of the experiment and the radiation exposure and so on and so forth. But he said, you know what the worst thing is that they deliberately excluded from that trial the very women that everybody beyond the Ministry of Health always knew would have actually benefited from a PET scan. And this journalist personality said to me, well, Dave, they had to exclude somebody, didn't they? Imagine. So, you know, another classic example of the job, not the challenge government, they were there to create the illusion that things were just hunky-dory. You know, and maybe one final example you might have thought was the ombudsman issue. I mean, here's this man is supposed to be the watchdog of Ontario. You know, he's made statements in the press about this is the most complex investigation he's ever done and so on and so forth. And the papers behind the news media, behind the scene, have all the information that the ombudsman does about, you know, what's going on. The ombudsman dismisses all this and then buries the report. Not a whimper from the press, eh? Very upset about Danny Williams getting his heart surgery in the States, but somehow the watchdog of the province of Ontario dismisses all this, buries the report, and then acts as a cheerleader for the government. Somehow this is not interesting news, for obvious reasons. The press, to me, is the archetypical example of the emperor has no clothes. And, I mean, to me, the news media is an utter disgrace to what they potentially could be, and some actually I think still would like us to believe. I think most would like to present themselves. Maybe they're living in some fairy tale world where they think that, gee, maybe people actually think that we're really getting out the news here. But you know that the internet and social networking has simply exposed these people for what they are, and shame on the media, you know, in Ontario and the Canadian national media as well. So, you know, on my website, I'm going to be making the occasional little digs at the media to say, please use your handling of the, you know, what the information you have on PET to prove to, I would say, particularly young journalistic students, to show them what a vital role they're going to be playing in getting to the bottom of news. And this is about keeping governments honest and blah, blah, blah. And maybe these students can figure out soon enough that time to get out of that career if that's what you actually thought you were going to be getting into. But the reality is, with the advent of the internet and social networking, we really don't need the media, and in fact what we're seeing you know, repeatedly on the news now, and through, more importantly, other sources like internet and social networking, is that in countries around the world, be they democratic countries or you know, or dictatorships, the fact is that they're able to bring about profound changes in their governance and so on. Why? Because they can get out in spite of their media, using their, you know, their cell phones and their social networking media and so on. So what I'm really hoping and asking you to do in Ontario here, I'm really stepping on a limb here. Believe me, there's no question. I don't think anybody, you know, doesn't know that the government is going to try and, you know, destroy my career, do whatever they can. But you know what? I no longer could look into cancer patients' eyes and say, I'm so sorry, if only you hadn't have lived in Ontario. What Dr. Dweger said is true. The process of blocking PET in Ontario is immoral. But remember, it's not just about blocking PET. This is about healthcare decisions in Ontario. So what I really want us to do is, you know what? I want us all to do a Justin Bieber on the internet. But for something this time profoundly positive and for real change. You know, healthcare is going to affect all of us at some point in our life, and I wish it didn't. But you know, it's going to. And for some people, particularly those with cancers, it's a devastating blow to your life. But to live in Ontario and be literally the last place in the world now to what, you know, what is considered the gold standard of diagnostic management of their cancers, is, I can no longer accept that. And I'm asking you to follow me on this one, and to get out there to challenge the politicians, the government's advisory groups and so on. You can challenge the media if you want, but you know that's really not necessary, because we can get this out in spite of them. You know, and one of the benefits of actually bringing about a real, potentially, you know, positive, profound change to our healthcare system, which is more rational, is more humane, is safer, is less expensive, in fact. You know, one of the side benefits, we may actually, believe it or not, get politicians, you know, that might actually be open, transparent, and accountable for a change. Wouldn't that be something as well? So please do what you can, you know, explore the website. Please get this out to everybody you can think of, and don't just look at it and say, yep, it just reinforces everything I believe. do something about it. You know, follow me, follow Sam Bruno, follow Al Drieger. Let's make some change here. Thank you.